Right, well, citizens across the globe have drastically increased their awareness around physical health and hygiene since the start of COVID-19 pandemic at the end of 2019. Well, this has highlighted on the World Health Day today, which is commemorated globally under the theme Together for a Fairer, Healthier World. The World Health Organization is calling for urgent action to eliminate health inequalities and to attain a better health for all. To continue then this discussion, we are now joined by the President of the Association of the Medical Councils of South Africa, Dr. Kgosi Letlape. Dr. Kgosi, it's always a pleasure to see you. Thank you for joining us here on SABC News.
Good afternoon, Flo, and good afternoon to the viewers.
Doc, let's talk about really the importance of commemorating a day like World Health Day, when you and I know that, we live in a country where, when it comes to access of good health, we live in one of the most unequal and really expensive. It's expensive to even get good health care in this particular country, and I'm sure there are countries that are even worse than us. What is the point then of celebrating a day like this when we know what the truth is?
I guess the point of celebrating it is to be able to evaluate where we stand, to be able to look at precisely those issues that you are raising about the fact that we do not have an equitable healthcare system, so that we could improve in terms of our performance and ensure that all citizens have equal access to healthcare and that we live up to the promises of our Constitution.
Yeah. Let's talk about the importance of universal health care. And also, since you raised the issue of evaluating where we stand, where exactly do we stand, Dr. Letlape?
We stand at a point where, as you've seen, even with COVID, it has exposed the gaps in our healthcare system, both publicly and privately. If you remember, when we started, there was a challenge in terms of accessing testing. Even those that have private insurance were not assured of access to testing because some of the funders were saying, we will only pay if your test comes out positive. If your test comes out negative, you are on your own. So you can see that despite the fact that those that are well-heeled live in a private utopia, it's also not a panacea to access to healthcare. It's seriously, seriously challenged. And the flaws in our overall healthcare system have been exposed. And we have a private healthcare system that costs a lot. And relative to what it costs, it delivers very little. And we have a public healthcare system that has pockets of excellence, but all in all, it is overwhelmed by inadequate resources, inadequate human resources, no finances, capex structures that are not adequate, physical infrastructure that is crumbling in most instances, and it is a beacon of apartheid. If there's one thing that has not moved a needle in South Africa post-1994, it is healthcare. We still have apartheid healthcare, and it's still, the apartheid in healthcare is sponsored by the parliament of today.
Yeah. Doc, you talk about the flaws in our healthcare system and, how they've really been exposed. And, and I think that many of these flaws might have actually been exposed even, before we had to deal with a pandemic. One could argue that. But, when it comes to how we address then these issues and, the problems that we're having within the healthcare system, we had started to talk quite a bit, and I see now it's a topic that's not spoken about much. But I remember the former Minister of Health, Dr. Aaron Motsoaledi, had been speaking quite significantly about the NHI bill, and this is something that we had been told would be something that would address the inequalities in terms of healthcare and the health system in South Africa. What are your views on NHI and where are we in terms of that? I mean, to be honest, there hasn't been a lot of talk around that of late.
My views are we need a healthcare system that is for all of us in accordance with the promises of our Constitution. What is happening globally, everybody is now talking about universal access to healthcare. It can only be universal if it's a national system. It can only be universal if it is based on solidarity. So the notion and the principles espoused by the NHI are something that all of us should support. Where we need to be particularly careful is that health is a disaster in this country, both publicly and privately, because of procurement challenges.
Yeah.
So we need to ensure that procurement is changed, that we are able to use what the apartheid healthcare system used to use, buying for all and being able to negotiate the best possible prices and being able to distribute to all the people that need to access those services. Governance should be an area that concerns us. I fully support NHI, but it is something that should be under parliamentary control, and the structures that control the various aspects of NHI, the critical components, for example, the board, those should be parliamentary appointments. What we cannot do is to try and create an NHI and we bring everything under the authority of one person. That would be a disaster, given what we have seen on the procurement space, in particular, in the last 25 years of independence.
Yeah. Doc, I'd hate
we need to ensure that an NHI,
yeah.
One of the things that we need to get out of the NHI, there should be no tendering in an NHI.
Yeah.
We should be buying the best possible that we need, whether it's equipment, whether it is drugs, whether it's human resources, at the best possible price.
Yeah.
So we cannot go into procurement. We have to work as a nation. We have to use the buying power of a nation to ensure that all citizens have access to good quality healthcare.
Yeah. Doc, I'd hate for us to leave our conversation on a negative note. What have been, as we reflect, as it is, of course, World Health Day, what have been perhaps some of the gains that we've had, in the last couple of years? One would say, scientifically, we've seen a lot of gains, and in terms of medicine, there might have been a lot of gains. But what is significant to you in terms of the gains that have helped when we're talking about dealing with healthcare?
Well, that is a very difficult thing to talk about. Let me just give you an example.
Yeah.
When we went into COVID, we recruited a lot of community health workers. We had a lot of people that came in and they could not be offered permanent jobs. And post the COVID, there were challenges in terms of absorbing them. So we have a serious challenge in terms of funding human resources in healthcare. Healthcare is a personal service environment, and human resources are going to be your major expense, and they need to be adequately funded. We are putting money in areas we should not be putting money in. Both publicly and privately, we have too much of an administration structure. We're losing a lot of the health rent to administration, both publicly and privately, and there isn't enough at the front line. So those are the things that we need to correct. I think the positive is that we are now in a country where we are able to speak about these issues. The positives that have come out of the COVID era is that science has been looked at, people have been, structures have been created where communication could occur. Where there needs to be clarity, it's where we need to separate the decision making. You see, part of our problem, which is not just in healthcare, is there being no separation between civil service and where the party ends.
Yeah.
And it is that continuum that is giving us a challenge in terms of service delivery and accountability.
All right,
Those that want to be civil servants have to be civil servants because they deserve it on merit, not based on political connections or deployment.
All right, let's leave it there. Unfortunately, we're out of time. I'm really sorry, we're out of time, Doctor. We're out of time. I'm sorry about that. We'll certainly continue our conversation at a later stage. Thank you for giving us your time, as always, Dr. Kgosi Letlape, who is the President of the Association of Medical Councils of South Africa.